So our aim is to consider various positions or orientations of the hand and to determine how can we manipulate the robot to reach a desired configuration. So this is the Vaidya robotic system with the base satellite stations, the camera and the robotic arm. So it is the fastest infrared camera with 250 GHz. That means it captures 250 shots per second and can transmit to the robot. It has hydrophobic arrays, so any liquid or blood don't break barrier with the camera. So it's a adaptive tracking technology. That means it tracks the legs and adjusts the saw blade to the cut planes when the leg moves. Angle of the saw will not change even if it is forced to move. The natural control allows the surgeon to freely maneuver the saw within the constrained cut planes. So this is the planning screen as described by previous speakers, where we can plan the cuts and balance the knee inflection extension. So this is the video of the adaptive tracking. So even if the leg will move, the saw immediately adjusts to the pre-decided angles. The saw holds the plane. So this is the study of robotic assisted device with manual instrumentation showing accurate resections with minimum error and absolute resection error being less than 1.5 in femur and tibial resections. So the key features are assessment of the patient anatomy is done without any need of CT scans as described by previous speakers, the hazards of CTs. Kinematic measurements are performed in real time. Surgeon can interactively adjust the proposed surgical plan including implant size and position. The device maintains the saw within the plane, resection plane, and surgeon is in full control of the robotic assisted device. Thank you so much.